Hello everyone, I am Vince Bagarosa with Community Connections. We recently interviewed Executive Director Achille Dejean of the Mental Health Association of Monmouth County in order to learn about the wonderful services this organization provides to the community. Established in 1950, the association is a mission-driven 501(c) dedicated to advancing mental health care and eliminating the stigma associated with seeking care. May is Mental Health Awareness Month, and the goal nationwide is to turn awareness into action. Programs provided by the association include case management, counseling and therapy, education, housing, and finance. Mr. Dejean will elaborate on these programs during the interview and discuss ways to seek assistance. We hope you enjoy this segment as much as we did, and thank you for stopping by.
So we've been turning awareness into action for the last 75 years. We were established in 1950, and we serve individuals, youth, family, and individuals who have suffered with severe mental illness. So we started back in 1950, and we were primarily a volunteer organization at that time. And during that time, mental health really wasn't being addressed, and it wasn't accepted. And we primarily focused on trying to raise awareness and increase advocacy so that those who were suffering and dealing with mental health challenges did have their needs met. Over time, we evolved and stepped into the service sector, and we provided services directly to individuals who needed help. We provide homeless outreach and case management services, as well as counseling services and support to families who are supporting their loved ones who have mental illness as well. What we've come to see is that really through transparency and openness, that's when people start to turn a corner, right? If they actually come and actually seek and actually are looking and can be connected now to services and support, now they can get some help. Mental health issues, mental health concerns doesn't discriminate. What we do know for sure is that everyone is impacted by mental health, and that everybody has a struggle or has a challenge.
That's right.
But not everybody has access to treatment, not everybody has access to services. And we want to make sure that we're able to fill the gaps where we can. And sometimes filling the gap is just opening your doors and ensuring that people know who you are and where you are and how to get help. And other times, it's really just making sure that you're able to help them when they come through your doors. We're one of 144 affiliates in the nation. Mental Health America is the mothership, is how I like to describe them. They're in DC, and there's 144 other mental health associations throughout the country. So if we can connect them to another MHA that can provide them the services, then we do that. And if there's another nonprofit or another mental health agency in the community that they live in, then we try to connect them. We do some advocacy as well. We also do some direct services in the community. So we're providing outreach to individuals who are unhoused. And our goal there is to really get them housed, to find a way to get them permanently housed. But in the meantime, if we can get them temporarily housed, that's also a success for us as well. So we actually provide some services at some of the senior centers in the county, where we are able to go in and provide some individual and group support for some of our seniors as well. We also have our outpatient department that does some individual counseling services, where we also are serving seniors there too. We ensure that our staff are trained and are culturally competent, as well as humble to the needs of the individuals that we're serving. But we also try to ensure that we're hiring staff that look like the people that we serve. We try to ensure that we are able to provide counseling services to the public. But in instances where somebody maybe is underinsured, we do a lot of fundraising and apply for a lot of different grants in order to ensure that we are able to cover some pro bono counseling sessions as well. Majority of our programs here at the agency are free to the individuals who are receiving those services. We receive some state funding as well to provide some of our homeless outreach, our case management services, as well as some of our youth outreach services and crisis response programs. If you're interested in supporting the Mental Health Association of Monmouth County, please check our website. We have a lot of opportunities for volunteering and as well as financially supporting us. We're living in a very unique time right now as it relates to funding and nonprofits, and every nonprofit needs some support. So I would just encourage you guys to check out our website, get to know us a little bit more, and if you feel so led, to please also support us and kind of join in on the mission. We talk about turning awareness into action, and one of the best ways to do that is to join with your nonprofits to turn that awareness into action. Thank you, guys.